The price of care, healthcare in the US and South Korea. Which is better, or are they equal? How do government regulations slash policies regarding the healthcare system in South Korea differ from those in the United States, and how does that affect population health? What to know coming into this video about the United States. First, low-income families tend to have worse access to good healthcare than high-income families. And there's a big range between those families with high income versus low income in the sense of money. Next, the healthcare that is received isn't great, but not bad. But that can lead to high out-of-pocket costs. And a difference between South Korea and the US is that the US outspends South Korea on healthcare per person. Now what to know about South Korea. South Korea has one of the world's best healthcare systems with how affordable they are. In South Korea, there's universal healthcare coverage. But there are a lot of unmet medical needs due to doctor distribution and more. Like the US, there's a high out-of-pocket cost, and your income shapes your access to healthcare. Now, we are going to look at graphs that show the differences of South Korea and the United States based on what we have talked about so far and what we will continue to talk about. This first graph shows the mean annual household income, dollar amount in thousands. It shows that the US has a very wide range of household income, while South Korea's isn't a very wide range. It also shows how high the average household income is in the US compared to South Korea. The next graph is the mean annual healthcare spending in dollar amount. We see the very big difference between the US and South Korea healthcare spending. The US spends between $6,000 to $9,000 annually per person, while South Korea spends between $900 to $101,000 annually per person. The last graph I'll be talking about is about adults with unmet medical needs for healthcare. You can see that the low household income families in South Korea have a much higher percentage of unmet medical needs than the US low-income families. South Korea has a very high percentage of average compared to the US.
The insurance systems in the United States and South Korea are structured very differently, and those differences affect how people access healthcare. In the United States, healthcare coverage is not guaranteed for everyone. The system is made up of multiple private insurance companies, along with government programs like Medicare and Medicaid. Most Americans receive insurance through their employers, which means coverage often depends on where someone works, how much they earn, or whether they can afford insurance on their own. Because of this, millions of people remain uninsured or underinsured, and coverage can vary significantly from person to person. South Korea uses a universal healthcare system based on a single national insurer called the National Health Insurance Service. Every citizen is required to enroll, which means healthcare coverage is guaranteed across the population. Instead of many separate insurance providers across different plans, the system is standardized, making access more consistent and predictable. The major differences is that the US healthcare system is fragmented and dependent on individual circumstances, while South Korea's system is centralized and designed to ensure that everyone has health care access regardless of employment or income. The role of government in healthcare is another major difference between the United States and South Korea, and it strongly influences how each system functions. In the United States, responsibility for healthcare is divided between federal and state governments, while private insurance companies still control a large portion of the system. The government regulates healthcare and funds programs like Medicare and Medicaid, but it does not directly guarantee health coverage for every citizen. Because private companies compete within the system, healthcare policies, prices, and accessibility can vary widely depending on location and insurance provider. South Korea has a much more centralized system. The national government plays the dominant role by operating the National Health Insurance Service and managing coverage for the entire population. The government also helps regulate costs, standardize pricing, and organize healthcare delivery nationwide. This allows the system to operate more uniformly and reduces many of the inconsistencies seen in the United States. So while the US system relies heavily on a combination of government oversight and private industry, South Korea's healthcare structure is government led and nationally coordinated. The differences between these systems matter because they directly affect population health and healthcare outcomes. One major issue is access to care. In the United States, people without insurance or with limited coverage may delay treatment because of cost, which can lead to more serious health problems later on. In South Korea, universal health coverage means that people are more likely to receive medical attention earlier and more consistently. Another important factor is efficiency and cost. Even though the United States spends more money on healthcare than any other developed country, it still struggles with lower life expectancy and higher rates of preventable deaths. South Korea spends less overall but achieves stronger population health outcomes due to differences in management, such as number of physician visits, which the United States struggles with. Overall, the way healthcare is organized and funded has a direct impact on the health of the population.
What you find is, if you look back to 1976,
all of these countries, the US, Germany, Canada, look similar in terms of what share of GDP goes to healthcare.
And they are all living, people are living about 35 years after age 40. Okay.
Fast forward 20 years, and the US is spending a lot more of its GDP on healthcare, and its life expectancy increases have not kept up with the life expectancy increases in other countries.
So why is the US such an outlier? Actually has the power to influence these regulations and policies. A very prominent influence is lobbying, but what is it and who is it done by? Lobbying is done by interest groups, individuals, or organizations like private companies. They use things like money and bribes, direct communication with legislators, and changes in public opinion to persuade lawmakers to take the actions that they want. This includes supporting or opposing specific legislation. Let's explore how exactly lobbying impacts healthcare in the United States. According to Open Secrets, $867.54 million was spent by healthcare lobbyists in 2025, making it one of the nation's largest sectors. Big groups include the American Medical Association, the American Hospital Association, PHRMA, the largest pharmaceutical lobbyist, and the Blue Cross Blue Shield Association of America. Now that you know a little bit about how lobbying works, we'll learn about its impacts, both positive and negative. First, a disproportionate influence. When excessive lobbying is done by groups with significant power, like via things like close personal connections, money, legacy, and deals, their private needs will be prioritized over marginalized groups, including people of color, disabled people, and low-income families. This compromises the equity of healthcare policy because legislators benefit those who want to profit, not those who actually need the most help. Another major impact is higher pharmaceutical costs. Lobbying from Big Pharma accounts for nearly $400 million. Because these companies have massive financial investments, they are able to exponentially raise medicine prices. To paint a picture, AARP, a nonprofit health company, found that nearly 1,300 common medications rose an average of 32% in just 1 year alone. KFF, a nonprofit research institute, found that nearly 1 in 5 Americans chose to skip treatment. The consequences are dire, with chronic conditions worsening and risk of infection increasing. However, lobbying can be very beneficial when done by the right people. A major example is the Affordable Care Act, which reformed U.S. healthcare by expanding Medicaid and creating health insurance exchanges. This act was heavily lobbied for by advocacy groups, grassroots, and patient organizations, despite heavy political opposition. Now that we've learned about lobbying in the U.S., what about South Korea? Lobbying is extremely minimal because of heavy regulations like quarterly reports, mandatory registration, and penalties for violations.
every time we go to the doctor for everything from an angioplasty to a hip replacement, from a C-section to a pain reliever. The irony of American healthcare, it's so expensive that it's become hard to make it cheaper.
Now let's explore a similarity between the two countries, which is the identity of people who tend to receive poorer healthcare. These groups include lower-income individuals who cannot afford insurance, rural communities that cannot easily access hospitals, and racial and ethnic minorities. In fact, KFF data from 2023 shows that Black, Hispanic, Native American, and Native Alaskan people were twice as likely to be uninsured as their white counterparts, showing that healthcare policy is not equal.
In both the United States and South Korea, citizens use advocacy and public pressure to influence healthcare decisions. In the United States, many groups push for reforms like expanded insurance coverage and lower healthcare costs because healthcare is not guaranteed for everyone. In South Korea, citizens also advocate for improvement to healthcare services and accessibility within their universal system. Even though the systems are different, and people in both countries still play an important role in shaping healthcare policy.
What's good and what's bad about each healthcare system? Good versus bad. U.S. healthcare system. Good. Pretty good healthcare quality. Wide range of services. New and improved technology and innovations, and short wait times for specialists. Bad. Very high costs. Limited access for certain groups. Complex insurance systems. Unequal care, and high out-of-pocket costs. Overall, the U.S. healthcare system offers quality care, but high costs and unequal access create major challenges. Good versus bad. South Korea healthcare system. Good. Universal healthcare coverage, lower average costs, short wait times, strong overall health outcomes, and easy access to care. But that easy access to care causes overcrowding in hospitals, lower doctor pay and heavy workload, less emphasis on primary care, high out-of-pocket costs when not covered, and aging population pressure. Overall, the South Korean healthcare system provides affordable and accessible care, but high demand can strain doctors and hospitals.
Despite the U.S. being the #1 spender nationwide on healthcare, they are the only high-income country to not guarantee health coverage, while South Korea spends much less but guarantees for everyone. One reason Korea sees better results than America is because each patient receives far more physician consultations per year at 14.7, while America is almost last at 4.0. Spending does not have direct causation to better results. The U.S. is dead last in this field with life expectancy at 77 years, while South Korea has an amazing life expectancy of 83.5. One potential solution for improving healthcare outcomes in the United States is increasing political pressure for guaranteed healthcare coverage. Lobbying efforts and interest groups could push for policies that expand access to insurance and make healthcare more available to all citizens. Since millions of Americans are still uninsured or underinsured, expanding coverage could help reduce delayed treatment and improve overall public health. Another important solution involves changing how healthcare money is spent. The United States already spends the most on healthcare globally, but that spending does not always translate into better outcomes. Instead of focusing primarily on expensive treatments after people become seriously ill, more investment could go toward preventive care and frequent physician consultations. South Korea's healthcare system shows the benefits of this approach. One reason South Korea has stronger life expectancy and overall population health is because people visit doctors more often and receive
committed,
earlier.
focused,
More regular
prepared.
consultations
At
can
all
help
hours of the
identify
day
diseases
and late
sooner,
into the night,
preventing
we're caring
complications
for
and
others,
reducing
using
long-term
new technologies
healthcare costs. By
and
improving
investing in our
access to
team,
healthcare and
facilities, and
prioritizing
community.
preventive medical care,
And although
the
the
United
world is
States
constantly
could
changing,
potentially
every
improve
day we
population
stand
health
ready.
outcomes
For
while using
75 years,
healthcare spending
we've
more
remained
effectively.
dedicated to caring for the people of East Tennessee. Then, now, and tomorrow, we're here.
What to take away from this video? Our possible solutions. First, the U.S. can change the way they fund healthcare, mainly by offering more frequent visits to physicians. Our other solution is that interest groups should take action and start lobbying for guaranteed healthcare coverage. Next, why should you know about the U.S. and South Korea healthcare systems? The cost of healthcare. The U.S. spends more money on healthcare, but more people still struggle with costs. South Korea provides universal healthcare coverage. Access to medical care. In the U.S., access depends on income, insurance, or employment. While in South Korea, nearly everyone has insurance, but doctors are limited. Quality of life and health outcomes. Knowing about both systems shows people how healthcare can affect their life expectancy, treatment, medical health care, and more. How do government regulations/policies regarding the healthcare system in South Korea differ from those in the United States? And how has that affected population health? Thank you for watching. By Sophie, Adam, and Kendall.